Hi, I'm Jen Vandermeer, founder of Reason Street. I do a lot of work with healthcare and business models. I'm also a professor at Parsons, Innovation and Entrepreneurship. It's a design school. But I am not here to represent that part of myself. I am here as a citizen of the West Village in the city of New York. I live in one of the most politically active and intense neighborhoods, I believe, in all of the United States. Jane Jacobs lived in my neighborhood. Any Jane Jacobs fans out there? Okay. Protest, march in the streets for the future of the city that they want to see and the past that they want to preserve. This little house is the narrowest house in the West Village. It's the former home of Edna St. Vincent Millay, the poet. St. Vincent, she was named after the hospital, St. Vincent's Hospital. Why? Because her uncle's life was saved there in 1892. We take our poets and our protests and our hospitals seriously in this part of the world. St. Vincent's Hospital served as a portal to the most important souls of our city for her long and wonderful life of 150 years. She witnessed much of our crisis and trauma, and in my lifetime as well. She was the epicenter of the AIDS crisis in the 80s, and she rose to the challenge to take care of the many people she saw come through her doors. And 15 years ago, last Sunday, she welcomed 319 patients on a critical day in our city's history. 3 of them died. There were snaking lines of protesters around, of people giving blood around the hospital, wondering what to do. Doctors and nurses and staff members with hands idle because we didn't know what was going to happen to us. And we all looked at each other and did what villagers do. We went across the street to the tile art store and we made flags and angels and happy, optimistic phrases, things that cynical New Yorkers don't normally do, to frame and hold and hug the images that started to show up across the street on the hospital walls. So you can see this hospital meant more to us than just the bricks and the equipment and the devices and even, frankly, the doctors, the nurses, the staff inside. This hospital witnessed our history. It welcomed our most important citizens. It took care of us, and it later struggled. A couple of years before its death, the hospital executives had a really grand plan. They wanted to get bigger. They partnered with a local real estate group and talked about selling air rights and building condos and getting bigger expansion plans. And sure enough, the neighborhood did what it does so well. We protested. We said, no, please get better renderings at least. And we thought maybe, I don't know, that was a red flag or something because something terrible happened. The hospital closed. It was a sudden shock for the people working there. Nurses, doctors, elderly citizens, holding hands in the street through rather intense protests. Some people chained themselves to the hospital doors. It did no good, and my elderly residents were probably the most touched and horrified. Where would they go? What would they do? When they had a heart attack, the nearest hospital is a long taxi ride in traffic across town. So enter that real estate family who said, no worries, we know what to do here. We'll build a giant tower, the Greenwich Lane, open to all, access to all. All you need is $3 million and a dream, and you can live here too. So my neighbors, they knew what to do and rightfully, again, protested. Real estate is a long game. The family that owned the space looked across the street to the old hospital generator and said, there we will build an AIDS memorial. That white building just to the top will become, maybe we'll sell it to a hospital and it will become an emergency center so the elderly citizens know they could walk somewhere. The MTA stepped in. They run the subways and they own and operate the air duct across from the hospital. They presented 27-something plans to New York City residents for a renovation, and we chose the simplest one with chain link fence, a memorial to those tiles. And I walked by there just yesterday with my daughter on the way to school, and over the weekend people had added more tiles. The New York City Historical Preservation Society worked with residents and citizens and developers and architects to preserve those elements, those portals, the entryway where we saw so many souls come and go. So when we walk by it, we can say, there stood that hospital that meant so much to us. And the giant, huge healthcare organization, Northwell, the biggest hospital New York has ever seen, is running the ER. And you know what? It's not so bad. We know that we can go there if we're conscious and we can walk. And if we're not conscious and we can't walk, we shouldn't go there. We know what it's for. They did a pretty good outreach job. So I look at all that's happened to us, and it makes me furious when I speak with healthcare executives and hospital doctors who are struggling to hang on to their jobs, to control their destiny, to compete, winner take all, eat or be eaten, and see it as a game of chess, a game of competition. That is not the game we're playing. Health is not a hospital. We rallied, we took on this complex system, we got over it. We miss her, we mourn her. I'm going to end with a poem from Edna St. Vincent Millay. Yet many a man is making friends with death, even as I speak for lack of love alone. It well may be that in a difficult hour, pinned down by pain and moaning for release, nagged by want past resolution's power, I may be driven to sell your love for peace, or trade the memory of this night for food. It well may be, I do not think I would. Thank you.